A nasogastric tube is a flexible tube that provides access to the stomach through the nose. Although inserting an NGT is a commonly performed procedure, it is not without significant risk if done improperly. Inserting an NGT in the adult patient involves assessing the patient to confirm he or she meets the criteria for placement, teaching the patient about the procedure and what is expected of them during the NGT insertion, measuring the NGT for insertion, inserting the NGT, confirming placement, and monitoring the patient for complications following insertion. Insertion of an NGT is usually a blind procedure, meaning it is inserted without direct observation using clean but not sterile technique. Insertion involves passing the tube through the nose, along the nasal floor, through the pharynx and down the esophagus until the proximal tip of the tube rests in the patient's stomach. The nurse is responsible for verifying the NGT has been placed properly prior to the initial use of the NGT and before each use thereafter. Standard precautions should be observed throughout each of the steps. NGTs are used in all patient care settings. However, they are most frequently in inpatient facilities because NGTs are used primarily as a short-term method of providing nutrition or following surgery to reduce the risk of vomiting. Typically, NGTs are inserted and removed by registered nurses, physicians, and registered dietitians. Registered nurses are principally responsible for providing the daily care of NGTs, as well as the administration of nutritional formulas and the installation of medication and other substances. Due to the invasive nature of the placement process, it is generally not advisable to have visitors present during placement or removal of the NGT. When reflecting on what I have learnt through completing this assessment task, firstly and most importantly, I have learnt at a basic level how to use iMovie, which I could now use in a training environment should I ever have the opportunity. I have also learnt and explored thoroughly the procedure for the insertion of a nasogastric tube and the concepts associated with the procedure. Whilst I found this assessment task challenging, I did enjoy the opportunity to learn a new skill.